I think we have to start, Dr. Shadid.
Okay, now we are live on Facebook, and I'll start recording. Professor Daryl, can you give me host again, please? To start the recording.
We don't have the chairman, right? So I'm not going
No,
to.
don't have.
I'm trying to contact him. I'm trying to contact him because this is in the calendar of everybody, and he is supposed to be there to make the opening speech of the. I'm trying to contact them both.
Awesome, let us start. I sent a reminder to the chairman early morning today.
I don't know. This is very weird. This is very weird. No problem. Okay. Maybe something happened with the new corona is coming around. Anyhow, Dr. Hani, are you going to open the camera, or you would like to be on the? Okay. Okay. On behalf of AfICTA, I'm Asim Wahbi, the Vice President for AfICTA. AfICTA is the Information and Communication Technologies Alliance, and we are more than 33 countries and representing the countries and organizations working in the ICT in the African continent. This is our fourth webinar we have conducted during 2021, and we have started the e-sessions, and this is considered our fourth. We have selected different topics to be covered within these webinar. Some of them was talking about the security of data. Some of them some other hot topics that we have seen in AfICTA. It is touched a lot of concern for the representative of AfICTA. We have decided, and being in charge for the North Africa and Egypt, representing Ittisal, of course, that we are going to take a hot issue that all the African countries are facing, and I think the statistics and although the statistics are not sufficient, and the information about the disabilities and the people with disabilities is not enough, but the topic itself is very hot. It was the discussion here with Ittisal, and we have decided to select this topic, people with disabilities, and how the ICT can help and can support and can work together with all the stakeholders to find solutions, to find a way of cooperation, to find supporting tools to those people. I'm very happy that we have succeeded to collect and to invite, and of course it's our honor that all of the participants today and the panelists are I'm so happy that they have accepted our invitation and participation in this seminar. Let me just give you a brief about the vision of AfICTA. AfICTA, since we have started in 2012, and Ittisal was a co-founder of this alliance. The vision of the alliance born to pursue the promise of digital Africa. With the COVID-19, we keep talking among ourselves, as I have said, how we can help, how we can support, how we can collect efforts from everybody to support this very hot issue. From the experience of others, inclusions of individuals of disabilities is not like a light that simply gets turned on or off. It is more like a dimmer switch that we are keeping on pushing and intentionally focus and performance metrics. It is a journey, not a checklist. Let me just give you a brief about our objectives of conducting this seminar. Encourage innovation of assistive technologies and industry-academia cooperation. This is one of the major objectives of conducting this seminar. Share learning, experience, and best practices in assistive technologies, accessibility, and people with disability inclusions. Agree on a clear recommendations for promoting assistive technologies and business with people with disabilities inclusion of African countries. This is simply our objectives of conducting this seminar. I'm sure that Dr. Abir, being our moderator in this very important session, at the end of the event, I'm sure that we are going to get the recommendation, and I will raise it as an outcome of the webinar to the board of AfICTA and to how we will be able to continue our efforts to achieve those recommendations. Let me introduce Dr. Abir because she is going to be, first of all, I would like to thank, and as I said, the participant in this seminar, Dr. Mahmoud, of course, our ex-Minister for Ministry of Information Technology and the chairman of Vodafone. I would like to Professor Rana Hilali, Executive Director of the Students with Disability Service Center at Shams University, Mr. A.K. Dew. I can't see him, is not in yet. Professor Darlel van Groen, the Director of Center of Community Technologies, and of course our moderator, Dr. Abir. Let me just give you a brief about Dr. Abir because she has a very rich bio, which we are honored that she is with us today. Dr. Abir Shukwair is currently the Assistant Resident Representative at UNDP Egypt and Inclusion, Growth and Innovation Team Leader. She is responsible for digital transformation, SMEs, and entrepreneurship, innovation, and governance. She holds a PhD in environmental engineering and MSc in computer science, both from the University of Nottingham in the UK, and BSc in chemical engineering from Cairo University. Dr. Shukwair has more than 20 years of experience in IT, technology transfer, and innovation, working with national and international organizations. She worked as an advisor to the Minister of Communication and Information Technology for Social Responsibilities and Services, and the founding executive director of the National ICT Academy for Personnel with Disabilities. She previously worked as the founding planning and monitoring manager and head of international cooperation at the Science and Technology Development Fund and the executive director for the Center for Future Studies at the Cabinet of Minister of Information and Decision Support Center. Dr. Shukwair worked as a consultant with several reputable organizations, including the European Commission and several UN NGOs. Once again, I really honored of having all of you together with us. hope we have a very successful event, come up with achievable recommendation that I promise that we are going to work very hard Ittisal and AfICTA to achieve it. Now the floor is yours, Dr. Abir, and hope everything will go smooth as we have planned. Thank you.
Thank you, Mr. Asim, for the opening remarks and for the nice and kind introduction. I am really honored to be moderating this important panel on assistive technologies towards African continental orchestrated efforts. And I'm also very honored to be accompanied by a number of prominent figures representing different institutions in Africa, including government, academia, private sector, and NGOs, to have a discussion on the role of assistive technologies in the lives of PWDs, and to shed light on the ongoing efforts in Africa and how we can align and join forces to better utilize assistive technologies for the PWDs. Let me start by a brief background on the global situation of disabilities and ICTs, just to lay the ground for the discussion. So let's look at some numbers, and according to the World Health Organization, 80% of PWDs live in developing countries, and 40% of Africa's population consists of PWDs. This translates into more than 550 million people with disabilities in Africa alone. On the global frameworks, the 17 Sustainable Development Goals of the United Nations emphasizes the need for inclusive societies and mentioned PWDs 11 times in many goals, including SDGs on education and inclusive education, SDGs on inclusive economic growth, allowing PWDs to fully access the job market, SDGs on equality, and it was emphasized that it is very important to socially, economically, and politically include persons with disabilities. Also, SDGs on accessible cities, transportation, and green spaces, and of course, SDG 17 on cooperation among all parties to achieve the goal. ICT accessibility and assistive technologies provide us with the tools to achieve the full inclusion of PWDs in our societies. And the UN Convention on the Rights of Persons with Disabilities that was enacted in 2008, it actually stressed the role of ICT in the empowerment of PWDs. And it obligates parties to enable PWDs to live independently and participate fully in all aspects of life through promoting access for persons with disabilities to new information and communication technologies and systems, including the internet. So this means that we already have the global frameworks, and it is always emphasized that all of the frameworks actually emphasize the role of ICT and assistive technologies in the development of inclusive societies. However, the implementation around is full of challenges. So today we need to hear from our prominent panelists how we can push for the inclusion of PWDs in Africa using assistive technologies, how we can push for innovations, what is the situation on the ground, and what's missing. I would like actually to begin this discussion with Mr. Ak Dude, the CEO of Africa Disability Alliance, so that we have an overview at the level of the continent. Mr. Dude has a background in business studies with an MBA from Business School, Netherlands. He has over 35 years of experience in disability, human rights, and development work within Africa and internationally. He's also an expert member in the leading the African Commission for Human and People Rights and working group on older persons and persons with disabilities. And also he was appointed by the Minister of Justice in South Africa to chair the advisory committee domestication of the UN Convention on the Rights of Persons with Disabilities. And he's also very active on the research related to assistive technology. Mr. Dode, thank you for being with us today. And I would like to ask you and to know more about the role of ADA and how do you see the situation of assistive technologies in Africa?
Thank you very much for this introduction. For some reason, my camera is not coming on, and I apologize for joining a few minutes late. I had a minor health issue, which has now been resolved. Now, the Africa Disability Alliance was established in 2003 as a technical agency that works with organizations of persons with disabilities, governments, either individually or collectively within the African Union organs, as well as the regional economic commissions. When we were established in 2003, the Africa Decade of Persons with Disabilities had not moved at all. And it was told, and everybody was concerned that the decade might end without any progress being made. So people with disabilities came together with their governments and agreed that the Africa Disability Alliance should be established as a technical agency and not just a DPO. So we are a coalition, really, of continental, regional, and national organizations of persons with disabilities, diverse disabilities. We have over 15 disabilities within our membership across Africa. And we have, over the past few years, worked on the policy front. First of all, working to call on African countries to ratify the UN Convention on the Rights of Persons with Disabilities. So that objective was achieved. We now have over 40 African countries that have ratified that convention. However, not all these countries are implementing the convention. So the next objective for us was to facilitate the implementation of the convention. This is what we are doing now. And then we were also tasked to work on, to develop and draft the Africa Disability Protocol. It's a protocol to the African Charter for Human and People's Rights. So that was done, and the protocol was adopted by the African Union heads of states and government in January 2018. So we would like to take this opportunity to call on African countries to ratify this protocol so that it can be implemented within the different countries that are part of the AU. And then, thank you. And then we were then tasked by the African Union to design what is called the Model Disability Law in Africa. And we did this with the Pan-Africa Parliament, which is based here in South Africa. So the Model Disability Law was developed and discussed across Africa. I remember we came to North Africa several times while we were discussing the Model Disability Law. And it was also adopted by the Pan-Africa Parliament in October, on the 19th of October, 2019. So we now have all the policy tools that we require in order for us to do disability programming. Now, it brings me to the next topic that you mentioned, which is a very specific topic on assistive devices. Now, almost all assistive devices in most African countries are not made locally. They are imported. And one of the studies that we did was to assess the impact of the COVID-19 on access to assistive devices. Many people with disabilities during the COVID-19 lockdowns could not find spare parts. They could not find the devices that they required because the whole world was on lockdown. And they were literally confined to their homes. And if there was any assistive device that broke down, then they would not be able to function. So it really highlights the fact that one of the things that we must do as Africa is to have clear strategies that relate to how to design, to develop, and to manufacture assistive devices that will help different disabilities over the long term. Now, it is very costly to manufacture assistive devices. So one of the prohibitive factors is the fact that just to manufacture my wheelchair, all of the parts together, it will be a very, very expensive operation. So we would like, however, to call upon African governments to prioritize this area of work. It's not that they don't have resources, they do. It's a question of really creating your priorities and to see whether you want your citizens to remain on social security or whether you want them to be independent and to be productive citizens. And for them to be productive citizens, they need assistive technology. And we are now going into the fourth industrial revolution, where technology will play a key part. And we would like Africans with disabilities to be in the forefront of the design and utilization of that technology. I think that let me stop here, and then I can answer any questions, or if there is an area in the topic that you had assigned to me that you want me to clarify a little bit further, I can do that. Thank you very much.
Thank you, Mr. Dudi, for your enlightening intervention. And I'm really glad to know that there are a lot of efforts at the policy level, and now we need to move forward to put such policies into implementation. And let me also comment on a very important thing that you mentioned, which is COVID. COVID showed us that persons with disabilities are the most vulnerable group that was affected by COVID-19. And here I will go back to the technology and the role that technology, the huge role that technology can play in informing them and including them. Just like imagine a person with hearing disabilities, he does not know the information. He does not know about COVID. He doesn't know where to go, how to get the vaccine, what are the guidelines. So technology here can play a really, really important role in saving lives of persons with disabilities. It's not only just only empowering them, but in many cases, and at the cases of crisis and disasters, it's really a life saver to persons with disabilities. Thank you. Now let me move to His Excellency Engineer Hani Mahmoud, the Chairman of Vodafone Egypt, and who has a vast experience with actually different stakeholders, including government, private sector, and the civil society. so that he can tell us from his experience how different stakeholders can play different role in pushing for or supporting the development of assistive technologies. His Excellency Engineer Hani has the 30 years of global, regional, and national business experience in the world's largest companies, including Xerox, Sanofi, Aventis, and Vodafone. He was in 2012 appointed as the Minister of Communications and Information Technology, and also the Minister of Administrative Development in 2015. He was previously appointed as the chairman of Egypt's Cabinet's Information and Decision Support Center and the chairman of Egypt Post. His Excellency Engineer Hani is very active on community services, as he is the chairman of Special Olympics Egypt and also on the advisory board for Special Olympics Middle East. Thank you, Your Excellency, for being with us today. And I really would like to ask you and know, as an ex-minister of ICT, and also still being very close to the ICT industry as the chairman of Vodafone, can you tell us your thoughts about how African countries can develop assistive technology as an industry?
Yes. Good morning, everybody. Thank you very much, Dr. Abir, for the nice introduction. Look, I mean, I'm working with people, disabled people or people with disabilities since 2003. So now it's almost 18 years in this area. And I went everywhere around the world, and I have experience with different countries on how they are doing in front for keeping disabled people included in the community and facilitating their life. So unfortunately, Africa comes in the end of the list in terms of focusing on disabled people and how we include them in the community, and also how assistive technology can help them. In most of the countries now, I'm talking about the Western countries, actually the assertive technology became an industry, as you mentioned before. However, I'm not sure that still this is the end of it. I mean, I'm not sure that we reach the point where we can say assertive technology became an industry, even in those countries. In Africa, we are still far away from dealing with assertive technology as industry type. What I have noticed all over, because I have the technology background, and also I had a good experience dealing with disabled people, especially in the mental disabilities like learning difficulties, autism, Down syndrome, whatever it is. So my worry in general that most of the products, technology products and programs that can help disabled people, 80% of them are coming as a second product from another product. You know, very few things in the technology were invented especially for disabled people, but they put the product, the research and everything to find out a specific program or a specific tool, and then they found out that it can help disabled people in that regards and try to tweak it in a way to help disabled people. However, the number of tools and number of things, technology things that can help disabled people are varied from even from the research tools, hearing aids, short vision aids, and I have seen in my work with the Special Olympics or mental disability that actually people, it's a life changer for them. I have seen or I heard a mother telling me, after you discover that my son had a problem with hearing and you give him this kind of tool to help him to hear, his life changed completely, because we thought it's a part of the disability that he has. I mean, he was a Down syndrome, and this comes sometimes with the disability, and they did not realize that if he put this hearing tool, his life will be changed completely, because he will be, his hearing will be much better than before. He can talk, he can do a lot of things. Same for the short vision tools that we are using to help people to see better. On the same time, I think not only Africa, I think worldwide, we need to deal with this kind of things as a separate industry. I mean, people start doing research and studies on how can we create or develop tools to help, tools or programs to help disabled people. And we don't wait until we find out a program or a tool, and then we try to modify it to help disabled people. In terms of how technology can help disabled people, there is a lot of channels, a lot of things, starting from speech to text, the tools that can make the speech into text for deaf people can understand it, communication tools to help people to communicate together, mind mapping. There is a lot of mind mapping and brainstorming tools to help those people, and also task management. I mean, especially in the mental disability, we have a problem with those people on how can they organize their day or their tasks, and how can they manage those tasks. So there's a lot of tools now in the market can help them and make their life better. I believe the assertive technology is a very important aspect for disabled people inclusion in the society. Actually, in our organization worldwide, the Special Olympics, which is actually the Olympics focusing only on mental disability, we actually do everything unified. All the sports now are unified. So when we go and play for the Special Olympics, we have 60% of the team disabled people and 40% normal people. And this kind of inclusion actually helped a lot to raise the development of disabled people, and at the same time give the normal youth the ability to deal with this kind of people that can be part of their life. So in most of the schools now worldwide, they do this kind of things in the school as well. So they have, I mean, I have a relative one who is really now 16 years old. He's sitting, he has a Down syndrome, and he's sitting in a class where part of the class are normal people and part with Down syndrome. And actually, the impact of his development was very high. But also, in this specific case, they gave him some tools that is not really giving to everybody except those people, to help him not only develop, but actually cope with the level of education that that other people are getting. So my advice here, number one, that assertive technology to be dealt with as a separate industry. Yes, of course, it's a part of the digital transformation and everything, but starting from the research to the development of programs and tools until we really experience it with those people and make it available, this should be an industry. And at the same time, I believe that Africa, because the number of disabled people in Africa is not actually little. We believe that almost between 12 and 15% of Africa people with disability. I mean, 15% of the population. So focusing, and actually what we need to do is to involve the technology experts in disabled people life. I had a personal experience with a friend of mine who actually got a accident and he lost one of his legs. And we could not find the latest technology, artificial legs here in Egypt. And I believe maybe the type of things that he actually got by the end in UK was not available in Africa, not only in Egypt. But with using this kind of artificial leg, make him now walk like a normal person. He can actually control his legs through a button or a remote control in his pocket. His actually morale went to the roof after he was depressed after he lost his leg. And now when he came back to Egypt, if he has a problem in this electronic artificial leg, he has to send it back to UK to be fixed and coming back to him, which is really a big problem for him to stay without his artificial leg. He has a normal one, not a high-tech one, but he used to use the high-tech one, so he could not actually stay for a couple of weeks without it. So to summarize what I've said, we need to mix between people who are working really in disability arena, or even disabled people with technology background, to work with the technology and especially the digital technology now to actually form an industry for assistive technology, because this focus will really make a huge difference and will speed up the development of this industry. Actually, I have seen, because of what I'm doing with the disabled people, I have seen the smile on their faces and their family faces when technology can help them having better life and be included in the community. And the best two examples, and very easy, is hearing aids and short vision age. Those people, after getting these high-tech devices, they change their life completely, and they really speed up the development of their skills and competencies. So I hope this webinar can really come with some recommendation and find a way how can you mix people with experience in dealing with handicapped or disabled people with the technology experts, and how can we put a plan starting from the research tools and going down until we have a full of range of tools and equipment that really depend on the high tech to help people with disability to be included in the community and to really ease their life and make it much better using the technology. Thank you very much.
Thank you, Engineer Hani, and yes, I really liked what you said, that assistive technologies, they usually come as a byproduct, not the main product.
Yeah.
I think here one of the things that we need to raise awareness of the industry people on is that the market for the global disabled and elderly assistive technologies market was valued at approximately $18 billion in 2017, and it is expected to reach $30 billion in 2024. So it's not only a matter of being good to the society or doing good to the society, but it's still a business, because we need to talk to the people the way they understand. Businesses are, at the end of the day, they are after profit. So it is a profitable market. There is a huge need in Africa. So I think this awareness raising on assistive technology as an industry is very important. Another point is raising awareness of the parents and the schools on assistive technologies, because many of persons with disabilities and their parents, They don't know that a simple tool can have a remarkable impact on the lives of persons with disabilities. So I think these two awareness raising areas to different stakeholders group I think are very important and can play a role in pushing for the assistive technologies market.
Yes, I fully agree.
Great. I also want to mention one assistive technology that I experienced or I saw, and it was a research that is being done by an Egyptian university, and it was very much important to athletes with disabilities. And this is maybe I'm not sure if you if any of the athletes that you work with use assistive technologies for their training. The technology that I am talking about was a kind of Kinect device that's like the PlayStation that the kids play with, and it was training the athletes at home on how to like play or to stand well, how to like move, make the right moves when they in a competition. So this, I think, was very important in the area of sports and how to enhance the training of athletes with disabilities at home. Unfortunately, this research did not really fly, did not continue because of funds and this kind of stuff. But I think here, this is a clear example how assistive technologies can also support athletes with disabilities. Have you came across any device that supported athletes with disabilities, even outside Egypt?
Yes, of course. There's a lot of tools and equipment helping them, especially. I mean, I have seen an iPad actually with special programs for helping disabled people. And those, when we saw those kind of tools and give it to our athletes, it was very helpful for them to grow up their skills and competences and feel like they became, especially in the mental disability, and they became actually as normal as they can. And I have seen those children having this kind of tool with them most of the time, because they feel like this is a tool that helped them to have a better life, and they love it. Even during nighttime, they take it and put it next to them, because this is their feeling that this small thing with the technology inside it actually make a big difference in their life.
Thank you so much, Your Excellency, Engineer Hani Mahmoud. And now let's look at the topic from another angle. Let's get an overview of the efforts of the academia and the research institutions on assistive technologies and how they use it to include persons with disabilities or empower persons with disabilities. And I have the pleasure to introduce Professor Darrell van Goeren. I'm sorry if I'm pronouncing it not correct. Professor Darrell is the director of the Center for Community Technologies at Nelson Mandela University in South Africa. She is a distinguished professor at the university and a recipient of several awards, including the UN Award for Innovation in 2020, a Commonwealth Digital Health Award in 2020 as well, and the Nelson Mandela University Vice Chancellor's Award for Research Excellence in 2020, and an award of Engagement Excellence for her work done in the fight against the COVID-19 pandemic in 2021. Professor Darrell holds a number of honorary positions, including Lifetime Fellow of the Discovery Foundation for Rural Health Innovation, an honorary professor at Amity University, and an extraordinary professor at Optentia Research University unit at Northwest University. Well, this is Wow, your bio. So thank you so much, Professor Darrell, to be here with us today. And I would like to know how the work of the community technologies center helping PWDs. I mean, community development is very important. The terminology is very broad. But can you please shed light on the work of the center in general, and how do you go about PWDs and the role of assistive technologies in their inclusion into the society in South Africa?
Thank you very much, Dr. Aber, and thank you for those kind, welcoming words. I thought rather than just speaking, I will share a little bit of what we do in terms of the center. So the center is a research and engagement center, and we have the vision of doing things in Africa, for Africa, by Africans, which is a topic that is very, very close to my heart, and something that I would really want African countries to explore, to ensure that we develop solutions that are contextually relevant in the African continent. Some of our priorities as a center is that of partnerships and collaborations on the African continent, also a global network, and then looking at the mobility to create and share experiences. And even in the time of COVID, we have managed to do that through the use of the technology itself. I think what is very, very important that we often lose sight of is that the communities that we engage with very many times actually understand what is necessary for them to solve some of their challenges or to overcome some of their challenges. But in many instances, they do not have the catalyst or the know-how of how to activate that. And I think that is the instance where academic institutions and then research centers such as our own comes into play, so that we can do some innovation in service of society. Now, Mandela University is a university that prides itself in the fact that it is a university in service of society, and that it creates innovations that can be used by the everyday person in the street. So it's not just meant to be academic research, but rather very, very applied research. So just to firstly speak a little bit about some of the areas that we work in, and that is basically innovation and innovative technology solutions. We are at the 4th Industrial Revolution, probably well on our way to the 5th already. And COVID has afforded us the opportunity to leapfrog certain things. So as much as what the pandemic has been very, very bad and very tragic, I think it has also created many different and new opportunities and allowing us to look at things very differently as we move forward. So as such, some of the work that we are doing is in the digital health space, but also working with civil society to co-create and to take some of the lessons that we've learned and apply that into the innovation that we do. One of our primary focus areas is that of accessibility, or then creating access to the use of technology for people with disabilities, persons with disabilities. But also at the same time, I want to put under that umbrella not only people with disabilities, but potentially even people with low literacy levels, and also the elderly population. And on the African continent, we know that we have a very large elderly population, and there is still a digital disadvantage amongst the elderly population. So we need to also look at how do we use technology in an innovative manner to ensure that there is equitable access across the board. So I thought I want to just share maybe 2 innovations that came from our university. The one is this particular one, which is Assistive Technologies. It's a mobile app that was developed by 2 brothers who studied under my supervision. the Irachirotis brothers. The one has a PhD in information technology, the other a master's in information technology. And they developed a sign language alphabet that is unique in the sense that it supports real-time chats over the internet using both fingerspelling and plain text. So often for people who have hearing impairments, it's difficult to communicate with their own families because people do not know sign language. So we looked at finding more innovative and easy ways in which to do that. And currently you can now use 10 different sign language alphabets to communicate with people. So whether you know sign language or not, it does not matter. If you download the app, the Sign Instant Message app, then you are able to communicate with that. The app is available free of charge in the Play Store, so and also on the Apple iStore. So if there are members of the audience who wish to engage with that app, please do so, download it from there. The second is something very different, and this is for persons with physical disabilities. On the screen to the right-hand side, you see Mr. Heinrich Williams and his service dog. Heinrich is an industrial engineer, and he became paralyzed as a result of a disease quite a number of years ago. And one of the challenges that he faced was to, in hospital, get the attention of the nursing staff because he was completely paralyzed. And being an industrial engineer, he started investigating ways of doing that. And on the screen now, you see the Q-Bell Care, which is rolled out in specific facilities in South Africa and being used by people who have motor disabilities or who cannot use their hands. You can see Heinrich does not use his hands. He has a service dog who moves with him all the time. And this is a typical example of something that was developed by someone within that situation who knew what was needed, but he just needed the catalyst to offset that and to do the design. So those are just some of the examples that I thought I would share with you. Thank you, Dr. Abir.
Thank you so much, Dr. Darella. And I think a very important point here is that you take research into the market, because one of the main challenges, not only for assistive technologies, but for many research, that it stops at the level of research, so it doesn't go to the market. So I think what you're doing is very important, that you are completing the cycle from idea to market. So this is very important. My question is, how do you engage PWDs in the development or throughout the development of such applications?
So because we have an approach of co-creation and co-design, we ensure that they are part of the conceptualization of the development of the products. So this is not someone sitting somewhere in an office and thinking, what is it that we would like to do, or what do we think could make the difference? We go out and engage with the actual beneficiaries of this and understand their needs and try some concepts, etc., to get their input. If I can think of one of the projects where we're working with people with visual impairment, it's always very easy to look at using the text-to-speech functionality that is built in devices. But when people speak with different accents, and as we all know, we have different accents, it becomes more challenging to train that system. So how do you go about to ensure that the interaction from the end user is a pleasant experience? And the only way in which to do that is to involve them actively and to ensure that they are part and parcel of solving those solutions and looking at what will work best for them, not just to take an off-the-shelf solution, but sometimes to build our own based on the unique needs. In South Africa, we have 11 official languages, and some of our indigenous languages are very, very challenging because of the click sounds that they have. So when you have to train a system to do that, it becomes quite challenging. To give you another example, we work with children with hearing impairment, and there's a need to introduce them to computer coding, programming, robotics, and so forth. So how do we do that in a manner that is meaningful? So they cannot hear the teacher, and the teacher cannot necessarily do this in sign language. So we have looked at virtual reality, artificial intelligence, bringing those together into innovative solutions that will not only engage the attention of the child, but also take them through a visual experience, because people with hearing impairment have a high focus on their visual experiences, just as the opposite is true. People who have visual impairment have a high experience in their hearing. So we try and build the context around the impairment and what are the strengths of people with specific impairments. And that you can only do through co-creation and co-design with those audiences.
This is great. I have another question on your relationship with the private sector. I can see that you do a lot of research. I'm just wondering, how involved is the private sector in funding the research, or are they interested in R&D on assistive technologies, or they're not looking into this field?
I wouldn't say they're not interested. They are interested, but of course they want to also look at the market space to see how they can enter the market. So we need to all the time remind them that oftentimes the very people who need access to these assistive technologies are those who do not have the financial means. If they have the financial means, they can buy off-the-shelf solutions. So the private sector involved up to a point. If it is a very innovative, very different type of solution, yes, then they are interested to see how they can look at that and make that as part of their corporate social responsibility initiatives. So we try and ensure that we have a public-private partnership and that we bring the government into the equation as well. So academic institutions, private sector, and government to feed into that, so that we're not only putting innovation and products out there, but that we also shape some policy and influence policy as we go forward to ensure that all the necessary role players are part and parcel of this. And of course, if we do that in a mass way, then the cost becomes affordable as well. And then try and also secure some donor funding for that. But I think there are two areas for me. The one is to convince the private sector that they need to put some of their social responsibility work towards this. And the second is to get our governments to put more money towards this, because I think government is also failing us in terms of how much money they are putting towards it. You can have the best policies in the world, but if you do not put some funding towards developing the innovation and making it available to the larger population that needs it, then of course it does not mean much.
I can see two raised hands. Mustafa Atiyah from the attendees and Dr. Shadid. So Mustafa, if you would like to comment or ask a question, please go on.
Thank you very much, Dr. Abir, for such a fantastic moderation as usual. And I really appreciate such an interesting and fascinating topic. And I'm a disabled person myself, so I definitely can can prove like how assistive technology was supportive. I'm currently working, just to give a quick background about myself, I'm currently working as a researcher and international consultant, and I got my MA and PhD from Leeds University in Disability and Inclusive Development, and I'm originally from Egypt. So I have two questions. One to the last speaker, definitely whose discussion was really interesting about research, and was definitely taken from your question, Dr. Abir, as well, about the connection between research findings and how these can improve the current available technologies for disabled people. We know lots of challenges faced by disabled people when using some applications or when using some assistive tools. And we also know lots of research and studies that has been conducted to maybe elevate these demands into academic context. But the question here is how industry, how factories and assistive technology companies are keen to contribute and learn from these researches, and how vice versa, how research institutions and departments are able to communicate these demands to industry as well. My second question, which is definitely to Dr. Hani Mahmoud, or the person who first speaks as well. We're speaking about difficulties within Africa for disabled people to buy or maybe to manufacture any assistive equipment. We're speaking about difficulties for someone maybe who is blind to fix his stick, or someone with wheelchair to fix his wheelchair, because we do not have maybe companies or factories or people who are responsible to do this. So what should be done? Do we rather than franchising these equipments in the Middle East, what should be done? Do we have to have specific companies to be working in assistive technology in terms of manufacturing? What should be done to decrease the price or the high price of equipments? Because as you all know, a braille display or maybe a screen reader software can cost a lot. I know that we already now in a good time where assistive technology available in all Egyptian universities, or if it's not most of them, but at the individual level, and speaking about lower and middle income countries, what should be done to kind of make more funds available or make more offers available for these equipments to be bought by disabled people in those countries? I know it's like big question, but just some opening discussions to some points that I'm trying to share. And thank you again for giving me the chance to give my questions. Thank you.
So thank you, Mustafa, for those questions. And I think if I can start by responding to the first one, I think what is very important is to note that in certain sectors, and specifically I'm now speaking in the South African context, of course, we have organizations and private sector industries that put up specific competitions for innovation and hackathons, etc., whereby they invite entries and they have categories of entries which speaks to this very market that we are speaking about now. And then they are quite innovative in that, because it is an innovation competition or an innovation hackathon or something along those lines, where there is then a prize money attached to the different categories to ensure that the researchers are able to take their research one step further and be able to go and test it in the marketplace. And then, of course, there's also a very strong focus from specific government departments on these to ensure that the research is incorporated into the government legislation, etc. So I think it depends a lot. In South Africa, there's a lot of research that is happening, and there's a lot of feedback into the different sectors, from academia to the sector to academia. The question is, what do we do with all this knowledge that we have collected in South Africa already?
Exactly.
Are we distributing it to the rest of Africa. And I think that is part of the problem, that we need to create better platforms, forums where we can actually share this information beyond our countries. Because I think individually on the continent, we've learned a lot of lessons. So how do we get a forum where we do that kind of thing? And I think that's something that we need to really investigate.
Thank you.
Yeah.
May I come in, Dr. Abir?
Yes, please. I think Engineer Hani, you wanted to comment on this?
Yes, actually, this is a very important point that Mustafa actually raised, because especially for Africa, the price of those kind of equipment or even software or whatever it is, or tools, is really very high compared to average income in Africa, because everything is relative. So because of the low income in Africa, those kind of equipment are really very expensive. So actually, I can put 3 stakeholders that can help us a lot in this. Number one, governments. I mean, this kind of equipment should come without any taxes, without any custom duties, they can really help reducing the price, like cars. I mean, cars for disabled in Egypt has 0 custom duties and taxes. So people with disability, they can really have a car with an affordable price, which again change their life completely and make them move around the city.
Absolutely.
So government. Number 2, the companies. I mean, the CSR budget, thanks God, the CSR activities now in Africa had a good weight, and most of the companies, if not all, are putting a budget for community service, and they should really support those kind of equipment and tools by actually giving. Normally, I don't prefer 100% coverage, because it will lose the value. But if they could decided to get 100 equipment or whatever number of things, and supported the community, the disabled community, by covering 50% or 70% of the price, that will help people to make it affordable for them, and they can have it and use it. The third stakeholder is a social community organization. Social community organization are now working, a lot of them are focusing on handicapped or disabled people, and they can direct their focus also into this kind of equipment. I believe in my organization, the Special Olympics Egypt, we are every 3 months, we do medical check on people with disability, but from the C&D society level, from the income point of view, and we give anybody of them who needs glasses or needs an hearing aid, we give it to them. And actually, when we buy them from the companies who manufacture it or actually imported it, they gave us huge discount to help us get more and help people to be actually connected. So those are the 3 stakeholders: government, companies and businessmen and women, and social organization. Thank you.
Thank you very much.
Thank you, Engineer Hani Mahmoud. We can have a comment from Dr. Shadid before we go to the last panelist, Professor Rana from
Thank you, Dr. Abir, for giving the speech. I have just 2 comments. Mustafa Atiya, I wrote you my email on the chat. I welcome to contact us in Ittisal. We have ideas how to do that. Professor Darrell, you mentioned the products and research are done. We have in Egypt companies, members in our organization who are working on these technologies. And maybe Professor Rana will give you an idea about that. So let us be in contact after this seminar to see how we can cooperate in this area. We might think of a joint hackathon or a competition done between Egypt and South Africa, done online, to help people with disability. Thank you, Dr. Abir.
Thank you. And I will definitely be in touch with you, Dr. Shadid. I think that's a very good idea. Thank you.
Thank you, Dr. Shadid. And now let's hear another experience from the academia as well, but this time from a center that's dedicated to providing services to students with disabilities. I have the pleasure to introduce Professor Rana Al-Hilali, the Executive Director of Student Disability Center at Ain Shams University. Professor Rana is a professor of physical medicine and rehabilitation at the Faculty of Medicine at Ain Shams University. She is also the Executive Director of Students with Disability Service Center in Ain Shams University. And she has been working in the field of rehabilitation of persons with disabilities since 2000, and working with Ain Shams University on the inclusion of students with disabilities since 2019. Professor Rana, in our discussion before this panel, you mentioned that your goal is to support establishing an inclusive community for persons with disabilities and enhance their lives and enhance their abilities as well. So please tell us more about the role of the Student Disability Center and what exactly does it provide to students with disabilities.
Thank you, Dr. Abir. I'm very happy to be with you here today. The Disability Service Center in Ain Shams University aims to assist in achieving the university's commitment to activate the Disability Act since 2018, and in line with the United Nations Conventions on the Rights of Persons with Disability. Its role is actually to remove all the obstacles that stand in the way of the equality between the students with disabilities and others, and accessing all the services and activities provided by the university. We don't stop at that. We try to raise awareness and change the negative impacts and wrong beliefs towards persons with disability. And we work to remove any constraints they face within the society as well. We actually serve around the actually known disabilities, or students with disabilities that we know that are present in the university are around 1,300 students. 30% of them are visual disabilities. 20% are with the hearing disabilities. We have motor disabilities, around 20% as well. The rest vary between multiple disabilities that have different disabilities with hearing and visual as well as motor. And unfortunately, we also have the learning disabilities and mental disabilities that we have to work with in the university, and that's one of the challenges that we face. What we provide in our center is providing note-taking facilities with speech to text, text to speech, providing a sign language translator within the lectures, printing materials, braille printers, braille readers, braille display. We try to provide personal devices for the students. As you know, that not all students can afford the technologies they need to actually be able to study at home. And we'll get into that when we see the challenges that we had around the COVID-19 pandemic. And we really need, we train them to use the computer. Not all of them know how to use these technologies. We train sign language for the different staff to actually be able to deal with the people with hearing disabilities. We do awareness campaigns for the parents, for the teachers, for the other students without disabilities. We try as much as we can to provide a unified environment in the university. In our center, we have text-to-speech softwares, the different like JAWS, Kurzweil, Duxbury, all this for the visually disabled and people that actually depend on braille reading. We have color filtering technologies as well. We try to provide FM transmitters for the hearing disabilities, magnifiers. We try to implement the different video conferencing softwares all over the campus as well. And students, we try to provide the accessibility of all buildings working on it, because we have a very old infrastructure as well, and provide custom-made wheelchairs for the students, as the students with the normal wheelchairs that are custom-made are not custom-made on them, cause deformities later on, and it's not really easy to use around the campus without actually a custom-made wheelchair. So we try to provide all that as well. Our challenges are as is. We have a lot of challenges, things that actually got to do with the university and challenges for the students as well. We have a very old infrastructure working on the ramping, the accessibilities of doors, the accessibilities of the actual lecture halls as well. And we have different campuses. We have like around 5 main campuses. We're working on our main campus right now for the accommodation of all the buildings, with the ramping and the lifting and the wheelchairs and the doors and the bathrooms as well. We lack the training of the staff members on accessibility tools and the documents that are actually accessible. We need the staff to provide the documents that are easily accessible for the students from the start. We lack funding as well. We try to cooperate and do partnerships with different private sectors to fund the technologies we need in the university. The problem is, and the biggest challenge is the sustainability of the technologies that we actually already have. Most of the technologies and the softwares that we have are purchased. Nothing actually made or by the university right now. So we need to purchase them. So we need continuous funding to keep
Professor Rana.
Yes? Yes? Hello? Is there a problem with the connection?
We hear you. It's okay.
It's okay for us. I think Dr. Abir lost the connection.
Oh, do you hear me now?
Yes, we do hear you.
Yes.
Okay, perfect.
So we have a problem with the sustainability of the technologies. That's what I was always talking to Dr. Muhammad about, our sustainability, which is a problem. And we started thinking about, we have a learning management system that we helped with the COVID-19. Everything went virtual, but there was a problem with these students that do not have the software at home to actually work with on the documents, whether with the visual disability or the hearing disability. That's when I started discussing the problem with Dr. Muhammad Shadid, because we want our LMS to be accessible. And we're actually working on that project right now to make sure to try to make the LMS accessible. We have another problem. Students that are born mute and deaf do not understand written Arabic or English well. They only understand their sign language. They cannot understand the text properly except if they're translated into sign language. So for them to just read the text of a computer is not fulfilling their needs to actually understand the curriculum properly. So we needed a sign language translator on the LMS to actually work with the students for them to understand the curriculum they need. That's what we were working on right now. That's basically the challenges for the students as well. Their relationship with the tutors is another problem. We have a large number of students that we have to address. We try as much as we can to tell them to come to apply for the accommodations they need and the necessity. But the other problem is the hidden disabilities, the people, the children, the students that really do not want to admit that they have a disability. We really hope and to help raise awareness, increase the industry for actually manufacturing and innovating in the accessibility tools needed by these students. I was just thinking of a tool that, is there actually a tool that directly translates from voice to sign language on the spot, like voice to written text? But as I said before, hearing disability students that are born mute and are born deaf do not understand the text very well. There's a problem with the literacy. So is there a software that actually translates the voice choose the sign language on the spot as an app on the mobile. Another thing is the sign language dictionary is different from each country. So what is applied in South Africa cannot apply in Egypt. So unfortunately, the application that is on the mobile might not work with us in Egypt, because the sign language in Egypt is different like the sign language anywhere else in the world, because we have different words, we use different as any other country. So that's another problem. We need to tailor each dictionary according to the country it's at. So that's going to be difficult for any software as well. The funding bodies, they are available, as we said before, as CRSs in different private sectors provide for the community service, and they provide the financial aid for that. But it's very large, a large sum of money to actually fund anything for the sustainability of the different centers around. We are a main center that serves the students, but we have 7 branches, mini branches in different faculties that we actually work together to be able to serve a large number of students, around 500,000 students of HMS University, some of which are around 1,300 disabled students in the university right now. Thank you.
Thank you, Professor Rana, so much. And I'm sorry for my unstable connection. But actually, you mentioned a lot of challenges, and I think that sustainability is one of them. The availability of broad technologies that serve the diverse disabilities that the students have. But this also brings me to one thing, is how your center is linked with Faculty of Computer Sciences and Engineering and the graduation projects of the students. I think this could be a very important, you can be a very important source of ideas to those students in Faculty of Engineering and Computer Sciences, so that they can address your challenges. Yes, it won't be a complete product, but it will be a start. Have you thought of this?
I am working with the engineering faculty as well as the computer science faculty, but mostly with the engineering right now, with actually using, they're working on different prosthetics for the hand and assistive aids and assistive tools for the students and of the society generally. However, they're just, as you say, they're research. They didn't, it's not something I apply it on students, I apply it on patients, but it's not manufactured on a large scale, so I can provide it for the different students that we have. So we still have to purchase them privately through the private sectors, and like internationally, there's nothing local right now. I know for a fact that there are industries that are going to start in Egypt to actually manufacture the prosthetic equipment for these students and for the society generally. But still, I don't know, Dr. Shadid will tell us how that is going with the software for the other students or other disabilities for the visual and hearing. I did not start with them or research with the computer science department on that issue yet.
Thank you, Professor Rana. Yes, I totally understand that this is still at the level of research, but this could be a way that we push for the assistive technology industry and awareness at university and in the community at large. Yes, Professor Darel has her hand raised, and I was actually going to ask you a question, Professor Darel, because you managed to bring research into the market. So I just thought of how we can make this connection. How can we make this exchange of information and knowledge between Nelson Mandela University and the HMS University, so that we can push in the same direction from having the ideas into the market. Thank you.
And thank you, Dr. Abir. And that was exactly what I was going to say, that these are the kinds of opportunities that we need to build on. whereby we can have joint ventures and joint events and even joint projects to ensure that we cater for the different markets and the context that we work in. The app that I spoke of, the sign language, for example, it does contain different sign languages for different countries across the world. You know, relevant to that particular country. But I mean, that's one small example. I think if one puts together with the industries in the local countries, if we put together a challenge to them to say, look, as researchers, we've come up with, we think this and this and this is what will work. Let's put out a challenge, a competition of some sorts, and work with them and work with the winners and make it a condition of the competition that if you enter this hackathon, for example, that if you are the winning organization, then you give X amount of your time to work with the academic institution or with an NGO or whatever to ensure that there is a product that can be used out there and that it can be tested out there with the real sample population. I think there's some innovative ways in which we can do that, and we just need to think a little bit differently to how we have done in the past, and then see how we exchange those ideas.
I'd be happy to. I think we can cooperate or collaborate to do researches to actually work with these students. We can try them on both students, both kinds of students from Africa and from Egypt, and end up with a product that can work for everyone, which is would be a great idea, actually. Yes, I'd be very happy to do that.
Thank you, Professor Dalala and Professor Rana. And very conscious of time, I would like to thank all the panelists for the great interventions and enlightening discussion. And I also see that we came up with few ideas of collaboration on the manufacturing of assistive technologies. And I would like to invite Mr. Asim Wahbi to give us the concluding remarks of this panel. Thank you.
Thank you, Dr. Abir. Thank you, everyone participated in this very interesting webinar. I think our selection at AfICTA board to have these subjects to be one of our events is a very good. It's really will end the year with a very good achievement. This is from my point of view. I think we came up, and I'm asking Dr. Shadid, of course, to translate all the ideas that we have collected for the remarks and for the outcomes of this very rich event to be addressed. Of course, I'm going to send it and to share it with all of you as the outcomes of this webinar, which we are going to raise to AfICTA board and to see how we can really make next year, 2022, is the year for achieving what we are talking about. For example, the cooperation, which Dr. Darrell has mentioned, and with Dr. Rana, this is a very good, and it's very good as well for our software companies. I'm not talking about the software companies in Egypt. I'm talking about the software companies in all Africa. I'm very interesting as well to see how we can make full use of the strategy set or the framework Dr. Doob have said about for the African Disability Alliance. We should make full use of such achievement in order to put it in ground to see how can we cooperate each in his region in order to achieve a real achievement for the population of the disabilities people who have all the right to enjoy life like everybody in the earth. I'm really honored of having all of you in our sessions today. I would like to special thanks to the Secretary of AfICTA, the Secretary of Ittisal. Special thanks to Miss Amani because she was the marketing head under the supervision, of course, of Dr. Shadid, who have organized this event, succeeded to collect all those wonderful panelists. Special thanks to Dr. Abir for moderating our session today. My apology that I don't know Mr. Thabo was not able to attend the opening. Mr. Thabo,
I'm here. Yes, sorry.
AfICTA. Yes, I'm sorry that Mr. Thabo. Sorry that you have missed the opening. I took the chance to welcome our people, but as long as you are here, it will be appreciated if you say some words for us, all of us. Thank you.
Thank you. Much appreciated for that, Mr. Asamoah. And I would like to appreciate all the panelists and your office for having organized this. I'm sorry I had some technology glitches earlier on, and thanks Dr. Shadid for helping me to come into the session. I'm unable to bring in the video. I think something is not correct in my system. But I would like to extend our gratitude as AfICTA in actually advancing this vision of inclusiveness. And with these technologies and discussion that we have heard today, it shows that we are actually very committed in ensuring that we actually make sure that as we move forward, those who are marginalized and especially in particular people who are differently abled, they are actually taken along the journey, our journey through technology and also through policies that are put as interventions to ensure that we take them along in this journey. I heard one of our attendees also speaking of the challenge of cost, and I hope that it is something that will actually maybe be resolved as we go along to make sure that there's access to these assistive technologies as we go forward. I am highly appreciative to everyone, including the attendees, for having graced us with your presence. Thank you very much, Asamoah, for having organized this, and the Secretariat on both organizations, AfICTA as well as your organization. Panelists, much appreciated. I thank you.
I think the last word should be going to Dr. Shadid because he is the hosting of this event. So I'm just giving you the speech to close the session, Dr. Shadid.
Thank you all for coming today. And special thanks goes to Dr. Abir. Dr. Abir was the motive behind the organization and the ideas. We're cooperating together last 3 months to organize and to collect. But actually, this is one of the webinars I attended lastly with rich content, and there is concrete output coming out. And I'm very positive for the future cooperation between Egypt and other African countries, between Ittisal and all of you in parallel. We shall work together to help PWDs. May I ask you all to open your cameras to have one group photo to document the event. So please, just for 1 second, open cameras and we shall take. Mr. Chairman, you can, yes, excellent. Your Excellency, Hani Mahmoud, please open your camera.
Dr.
Does it allow me to open the camera? It says you cannot start your video because the host has disabled.
Now you are the co-host. Go ahead.
Okay.
Dr. Dube as well.
Yes, now it's
perfect.
okay.
Okay, Dr. Dube, Thank you all very much. And
I want to,
Thank you,
I
Dr.
want to
Shadid.
thank, I want to thank you very much for inviting me to this session. I look forward to the follow-up and to the cooperation.
yes,
It reminded me when I visited Egypt and I went to NAID and I saw the great work that you are doing there. And we are very, very confident that we'll be able to cooperate in future. Thank you
We
very
shall.
much for
Thank you all.
inviting us.
Thank you very much.
Thank you.
Thank you.
Thank you all.
Thank you. Bye-bye.
Thank you.